navigated TKR, conventional TKR, not much, a few radiological outliers, but functionally, survival-wise, survivorship all same. No differences at all in revision rates. Whether you do with navigation or conventional, no advantage. So same. So navigation became like that. Then people started doing keeping the navigation in one corner of the OT, and then they started doing conventional only. So that was there. Then again the digital revolution started happening, and we all know and we cannot deny that technology is growing in a fast pace. In what space? We have to see. So in 2007, when you Google evolution of man, if you go into Google search and say, see evolution of man, definitely you will see this picture. Every time you Google, what is that? Man started using cell phone and always started walking, bending like this because of mobile phone. That is in 2007. So in 2024, if you Google evolution of man, this is what it says. Man sitting always in front of a technology gadget. Anytime, always we are, whether we are a surgeon, engineer, anybody, we are in front of a system. That is what is happening. Evolution has gone to that level. Why? The technology is growing in a very, very fast, rapid manner. Started with 2G, but we are in almost now 5G is becoming very old. 6G, 7G, already in US, I think 6G is in vogue. So when this rapid pace, we are in this era now. Anything we are asking the chatty, whether we are traveling in the airport, in the room, bedroom, everywhere, we are sitting with technology and gadget. Why? We are using it. We are not always using it in the wrong way. Yes, we are using it. So technology is going in leaps and bounds. This is also there. Technology has gone to this level of sex robots. So where are we? In future, I'll tell you, people are telling that phones and laptops will go away. Only these kind of already Vision Pro is there. So Google is doing so much of big way research, and this is what in future is prediction. So revolutionary things are happening. So these owners of these companies are smarter. With this kind of technology, what are they doing? They are pushing this technology into the theater, into our OT. And what is that? Our OT is becoming like this. Everywhere around our OT, there is only patient is there in the center in a small table, that's all. Around that patient, everywhere technology, gadgets, everywhere. This is what. So surgeon, we are getting confused what to do so much. So like that only, this robot jumped into my OT. I didn't go behind the robot. Robot jumped into my OT. So in that way, I also started doing. And initially I was little skeptical. But was there a real need for me to start a robotic TKR? No, there was not at all. So what was that? But still, situation compels, and like that the situation compelled me to do the robotic totally replacement. So my journey started in 2022 in my OT with this Wellness imageless system. And then I started doing few cases, and this is one of the first few cases, pre-operative X-ray, 62-year-old female, long leg film, everything is done. All this calculations, screen matching, balancing was done. Post-operative X-ray was looking like this, okay? And immediate post-operative period, patient was able to bend and do good ROM. Is there any difference between a conventional totally and a robotic totally done? Yes, there was a slight difference between the rehabilitation. Patient pain was little less, result was encouraging. Then I started looking at it in a different way. So then I thought, oh, there might be something really good in that. Let me look into it in detail. So slowly unilateral started, bilateral cases I started doing with robotic cases. This is one of a doctor's father. So bilateral cases were done, balancing was achieved, and these kind of post-operative X-rays we started seeing. Almost all the post-operative X-rays were looking good. Patient was happy to walk without much pain, and you can see next day after surgery, patient, maybe we are a little biased, thinking that because of robot patient will walk, we are making them to walk. Probably even our conventional totalies we should make and walk and see, but still, in regards to pain management, yes, patients are reasonably better with pain, and their ROM is also good because we are having numbers on the screen. We are able to correct all those small deficiencies of residual flexion deformity or hyperextension, mediolateral instabilities with proper balancing, we are able to achieve these kind of good results and good alignments. And then all this big debates about this alignment also started coming in. I am not a big fan of too much of altered alignments, but still either it is an anatomical or a mechanical alignment, and nowadays mechanical also has become more changed, little bit of altered, called as functional alignment with the robot. And apart from that, another group started doing kinematic alignments. So all these things, altered alignment, if you are a believer in this philosophy, it has to be technology assisted. You cannot do a non-technological assisted altered alignment. It has to be a technology assisted. So with this, yes, my indication started more and more, like these kind of cases, 73-year-old female, osteoporotic, implant in situ, long femur nail. If you want to do a total knee, we have to do as either a 2-stage or a single stage, remove the implant, put in a rod, chances of blood loss so many we can do, that is not that, but technology helped me to do it in a single stage without removing the implant. Patient was happy, early post-operative mobilization, less pain, no much of blood loss. So this is a big advantage. Then this way I started looking at the robot in a different way. So what are the advantages? We already told about these things. Accuracy in bone cut. This was the one which I really liked about the robot. Too good. Accuracy is perfect. If you measure 9 mm, the robot will give you, the cut will be 9 mm. If you say 10 mm, it will be 10 mm. Then the balancing becomes good. Each system has got its own way of balancing. In this system, there is an acu balancer that helps to, it tensions by itself. You don't need to tension it. It tensions medial and laterally. So you will know how much of soft tissue laxity is there. With that help and with the screen numbers there, you can balance it perfectly. So it made me to look at it in a different angle. So I wanted to have some data out of it, whether to believe it or not. I did an early assessment of total knee managed with the imageless robotic system. And with that, I was able to come to this conclusion. Excellent patient satisfaction in terms of clinical outcome with better overall patient satisfaction scores. It is a very early assessment of 6 months to 9 months period. With that, the results were promising. The functional outcome patients were doing well. So, comparable outcomes, I looked at the literature. But if you see, robotic assisted and traditional, not big difference. But in regards to pain management and accuracy, surgical precision and early good rehabilitation, definitely robotic assisted totally scores over the conventional ones. Again, few articles, yes, there are articles coming out saying that both are not same, both are different in early post-operative period, after 3 months might be same, we have to wait and see, but definitely there is some advantage. And recently published article 2023 about mechanical alignment for total knee. It is not about conventional total knee, it is the mechanical alignment. They say there are some flaws, but we are getting good results with conventional also. But recently published that understanding the flaws of our practice is essential to determine the solution. So in our conventional total knee also there might be some flaws which we might miss noticing it or we might neglect it. These are the two important things which can happen. If you are able to find that, we might be a still more better surgeon, the patient will benefit out of it. How we are going to find that? Technology. For that, robot really helps. So due to deficiencies in both knowledge and technology in the past, we were far from replicating near normal kinematics. So the buzzword is we are trying to recreate the near normal kinematics with the help of robot, and that is with the help of technology and also with newer implants. So we have to have some sort of technology assisted personalizing good surgical technique, which almost called as the resurfacing the joint surface to restore the pre-arthritic anatomy and soft tissue laxity, which makes sense. So we have to be we have to accept that yes, this technology is there. So personalized knee arthroplasty techniques may allow faster recovery, better functional score, which is very important, pain relief. These first three important points with similar survival rates. Yes, for this we have to wait for a longer period of time. Whether this longevity of implants, there will be a difference. For that we need 10 years of follow-up, 15 years of follow-up. Have some peace of mind, because conventionally when you do, you know that it is going to do well, but regards to patient satisfaction and pain management, we are always a little bit on the back seat in conventional total knee. That way, if technology is going to help, patient is also happy. So summary of a robotic surgery, I will say, in my book, the most important thing is accurate and precision. That is precise bone cuts, perfect component placement. In particularly in femoral component rotation and all, conventionally it is very, very challenging. You have to have experience eyeballing, but with robot, definitely it is helpful. Very less pain, excellent patient satisfaction in the early post-operative period. Definitely, is robotic surgery going to stay? Yes, that is what I will say. It is definitely there to stay and give us some good results. So in 2024, if you're going to Google evolution of robots, so it will happen like this, it will show like that. That is what has happened. Thank you.
Clearly explained. No other than Rajkumar can say conventional to robotics. In fact, I know him very well. He's the guy who has done most of the conventions and using navigation for only complex cases. And today, he is himself done